Lab Solutions, CADCA, and state-level partners and community coalitions. Change Lab Solutions, for some of you who may not know, is an organization that's composed of an interdisciplinary team of lawyers, urban planners, architects, policy analysts, and public health specialists. Change Lab Solutions provides analysis on environmental change strategies, developing educational toolkits and fact sheets. And they provide on-demand training and technical assistance to support stakeholders in their policy reform efforts. Change Lab works in the context of land use and transportation planning, childhood obesity prevention, tobacco control, alcohol, food systems, school environments, alcohol-related harms, and more. And we've been fortunate to be working directly with Sabrina Adler, the senior staff attorney from Change Lab Solutions. So we'll talk more about them, but they've been one of the great partners in this effort. Another set of partners is the state-level partners and community coalitions, and they've been represented by an expert panel composed of 11 statewide members of the National Prevention Network, and also members of coalitions. And I think some of them are on this call, and they were on the previous call. So we thank you for your support throughout this project. And finally, for those of you who may not be familiar with CADCA, Community Anti-Drug Coalitions of America, CADCA is a national nonprofit member-based organization located in Alexandria, Virginia. We were founded in 1992 as an outgrowth of the first President Bush's Drug and Recovery Council. CADCA's mission is to build and strengthen the capacity of community coalitions to create safe, healthy, and drug-free communities. And some of our partners, along with partners from the Center for Disease Control, may be on this call. We thank them and welcome their support throughout this entire process. And so just one more little piece of information here before we get into the meat of the material. Because we have a diverse set of partners here, we want to provide some very important disclaimers. And so the first one, I'll actually read those to you. The first one is from Change Lab Solutions. The information provided in this discussion is for informational purposes only and does not constitute legal advice. Change Lab Solutions does not enter into attorney-client relationships. Change Lab Solutions is a nonpartisan, nonprofit organization that educates and informs the public through objective, nonpartisan analysis, study, and/or research. The primary purpose of this discussion is to address legal and/or policy options to improve public health. There is no intent to reflect a view on specific legislation. So as the disclaimer says, our intent is to provide you with information.
Please enter your PIN code followed by the pound key.
Okay. The second disclaimer is from the Center for Disease Control, another partner. This webinar was supported by a grant number and agreement awarded to the Change Lab Solutions and funded by the Centers for Disease Control and Prevention. Its contents are solely the responsibility of the authors and do not necessarily represent the official views of the Center for Disease Control and Prevention or the Department of Health and Human Services. But this says the information is solely the responsibility of Change Labs in CADCA. And so just to give you a picture of who you're talking with today, my name is David Shavel. I'm a trainer and consultant with CADCA. And another trainer who will be joining us in just a few minutes is Sharon O'Hara, who is an alcohol policy subject matter expert. So we look forward to hearing from Sharon. So the objectives for this webinar, what we intend to do over the next hour or so, is to let you know about some very important and very useful tools called the Prevention Status Reports for Alcohol-Related Harms, that these tools are available from you. And we want to let you know that these tools provide a variety of information, specifically strategies about several evidence-based, policy-based strategies to address excessive alcohol use. And we want to provide you with additional resources on other information related to this topic. And also, we want to share some information about an exciting project that CADCA and Change Labs and our state and community partners have been working on. So we'll be able to do all that with you. And finally, at the end of this, as I said, we will send out a survey for you to provide your feedback and comments, and those will be very appreciated. So what's this all about? Well, we know that there is an alcohol abuse problem in this country, and the Center for Disease Control has recognized that there is excessive alcohol use in the country. And so based on the Center for Disease Control Vital Signs report, they've defined excessive alcohol use as binge drinking for men of 5 or more drinks consumed on one occasion, or for women, that would be 4 or more drinks on one occasion. And it's also interesting, and this is relatively, for some people, surprising information, that excessive alcohol use is also for men 15 or more drinks during a week. So that's a little bit more than 2 a day. And for women, it would be 8 or more drinks on average per week. That's a little bit more than 1 a day. And then we also know that excessive alcohol use is any use by pregnant women and any use by those under 21, which is the illegal alcohol use. So we know that this is the definition, and based on this definition, and this is the information that the Center for Disease Control is most concerned about, are some very serious costs of this excessive alcohol use. And we know that 1 in 6 or more than 38 million U.S. adults binge drink. That's about 16% of the adult population. And we also know that based on the latest Surgeon General's report, there are approximately 1.6 young people who are binge drinking as well. So that's a large number of binge drinkers or excessive alcohol users. And we know that those that do binge drink at a rate of almost 4 times a month. So they're drinking on multiple occasions. We know that the human and economic costs are very severe, as you can see, with over 80,000 deaths each year related to excessive alcohol use. And that's in addition to the non-fatal and related health issues resulting from the alcohol use. We also know that there's over $200 billion cost to the U.S. economy for such things as increased healthcare costs, crime and property damage, and loss of employment productivity. So in recognition of this serious problem in the United States, the Center for Disease Control, as they do with a lot of other health issues, have published these prevention status reports. And if you haven't had a chance to see these, you're in for a real treat. These reports are a wonderful tool for raising awareness at the state and at the community levels about this problem of excessive alcohol use. And so what the Center for Disease Control has done is they provided in these reports a description of what is the excessive alcohol use problem, what are some proposed solutions, evidence-based, policy-based solutions, and then what's really exciting is they provided the status of those solutions for each state and the District of Columbia. So what we're going to do for the rest of this webinar today is to walk through some information about what is provided through the prevention status reports, and then tell you about our project that CADCA has been working on with ChangeLab Solutions. And the goal of that project is how can we disseminate this valid, vital, useful information even better than has been done in the past to states and communities. That's what we're going to be talking about. And for those of you that are able to, you can go look at the status reports, which are at www.cdc.gov/PSR. That's for prevention status report. And so what these prevention status reports are, they're developed by the Center for Disease Control from their state, tribal, local, and territorial support office. And they've got input from various programs. So what's exciting is that these prevention status reports are provided for the 50 states and for the District of Columbia, and they're provided on 10 different topics. And if you're not able to read that, it's alcohol-related harms, food safety, healthcare-associated infections, heart disease and stroke, HIV, motor vehicle injuries, nutrition, physical activity, obesity, prescription drug abuse, prescription drug overdose, teen pregnancy, and tobacco use. So as we said, for each of these 10 topic areas, and what we're focusing on for this webinar is alcohol-related harms, they provide information about the problem, the extent of the problem, some evidence-based, policy-based solutions, and the ratings of those solutions for the status for each state and the District of Columbia, as well as references for additional information. So there's a lot of information that is already being provided from the Center for Disease Control and Prevention. And so what the Prevention Status Report does, they provide, again, as part of the first element, describing the problem, They provide information on, as you can see here, a range of data related to excessive alcohol use. And what's nice about it is, as you'll see, they not only provide data for the state, they provide that data that can be used for comparisons with the national data, and they also provide trends on how your state is progressing. And someone may be having trouble with their phone, and so you may want to press *1, that'll mute your phone. Okay. So this is an example where we're talking about the first part of the prevention status reports, which is the problem. So this is an example from the state of Wisconsin. And so as you can see, you can't read the print here. It is very clearly, obviously, on the status report itself. But you can see here they provide a description of what are the measures that they're using. Then they provide a range of data, again, providing the state-level data, allow you to compare it to the national level data. They show trends in the data, and they're able to show what the economic cost is for your particular state. So it's an exciting tool to be able to really start to say, what does this look like in our states? And we'll talk a little bit more about how we can use this information to have these conversations within our communities as well. So what we've done here is talked about the first element of the prevention status reports, which is the problem. And if I can do this, yes, I can turn it over to soon-to-be Dr. Sharon O'Hara, who's going to talk to us about the status, the policy solutions and status. So take it away, Sharon.
Thanks, Dave. Appreciate that. So the solution part of the PSRs are actually policies that we're going to be talking about. And in order to select the policies that are included in the PSRs, there were certain criteria. One of them was that the policy had to be able to be monitored using state-level data that are readily available for most states and the District of Columbia. And then in addition to that, it had to meet one or more of the following criteria. So supported by systematic reviews of scientific evidence of effectiveness, like, for example, the Guide for Community Preventive Services, which is a collection of evidence-based findings of the Community Preventive Services Task Force. And that is an independent, non-federal, unpaid panel of public health and prevention experts that were appointed by the director of the CDC. Another criteria explicitly cited in a national strategy or national action plan like Healthy People 2020. And you're probably familiar with Healthy People, which is a federal initiative out of the U.S. Department of Health and Human Services that provides science-based 10-year national objectives for improving the health of Americans. And or it had to be recommended by a recognized expert panel, body, organization, study, or report with an evidence-based focus. And that would be something like the Institute of Medicine, or the IOM, which is a nonprofit organization established back in 1970 as a component of the U.S. National Academy of Sciences. And it works outside the framework of government to provide evidence-based research and recommendations for public health and science policy. So we're really talking about policies that have been studied and that are shown in the research evidence to be effective. So meeting that criteria, we have two policies that are included in the PSRs, increasing alcohol taxes and dram shop liability. And these are both in the 2015 PSRs. Then there's another one that was recommended by the task force that we're going to talk about, which is regulation of alcohol outlet density, and that's included in the PSRs from 2013. So I'll be talking about all three of those. Starting with talking about the status of state beer, wine, and distilled spirits taxes. So these are on the CDC's PSR website, and I want to talk a little bit about the way these were rated. The states were rated either green, yellow, or red based on state excise taxes. And the green rating indicates that the policy or practice is established in accordance with supporting evidence and expert recommendations. A yellow rating indicates that the policy is established in partial accordance with supporting evidence and expert recommendations. And then the red rating indicates that the policy is either absent in the state or not established in accordance with supporting evidence and or expert expert recommendations. So the state ratings for taxes are actually based on actual state alcohol tax levels. The cut points that were used to rate state alcohol taxes are based on the distribution of alcohol excise taxes in states by beverage type. You probably know that excise taxes are different than state taxes because excise taxes are assessed on volume as opposed to sales tax, which is on price. So the excise tax ratings are not based on recommendations about the most effective tax levels. In fact, expert reviews of the available research do not recommend a specific tax level. They do provide the following guidance. First of all, larger alcohol tax increases are generally associated with greater reductions in alcohol-related problems. And secondly, alcohol tax rates have not kept pace with inflation over time, so have become less effective with respect to reducing excessive drinking. Using these two research findings as a guide, states with comparatively high alcohol taxes were rated as green, which meant at least $1 per gallon for beer, $4 per gallon for wine, and $8 per gallon for distilled spirits. So for beer taxes, you can see here, using Wisconsin as an example, and you can look up your own state on the PSRs, that's the beauty of them. But this example for Wisconsin, you can see clearly that Wisconsin is rated red because their beer tax is less than 50 cents per gallon. And the way this worked was, as of 2014, state beer excise taxes ranged from 2 cents to $1.29 per gallon across all the states for which data were available. And Wisconsin was less than 50 cents, which put it in the red category. Excuse me. In states where there were differing tax levels for on-premise versus off-premise, on-premise, of course, are bars and restaurants. Off-premise are stores where beer can be found. If those differed, then the off-premise tax rate was reported. Interestingly, studies show that a 10% increase in the price of beer would likely reduce beer consumption by approximately 5%. And in all cases, doubling alcohol taxes could reduce alcohol-related mortality by an average of 35%. So Wisconsin's beer tax was 6 cents per gallon, and that's what put it so low. So looking at the whole picture of the United States as of January 2014, the majority of the beer taxes were in the red category. 42 states had beer tax that was less than 50 cents per gallon. 4 of them had taxes between 50 cents and 99 cents, and only 4 had a beer tax that was greater than $1 per gallon. Moving on then to looking at distilled spirits taxes, again using Wisconsin as an example. So the information from January 2014 said that state distilled spirits excise taxes range from $1.50 to $14.25 per gallon. As you can see here, the categories are less than $4 a gallon is the red category, $4 to $7.99 per gallon is the yellow category, and greater than $8 per gallon is the green category. And Wisconsin came in red again at less than $4 per gallon. And the studies show that a 10% increase in the price of distilled spirits would likely reduce distilled spirits consumption by approximately 8%. And then again, that would reduce problems related to consumption as well. Across the U.S., as of January 2014, the majority of states once again fell into that red category, less than $4 a gallon. 11 of the states in 2015 fell into the yellow category, and only 3 states fell into the green category of greater than $8 per gallon. Looking at wine taxes, as of January 2014, the state wine excise taxes ranged from 11 cents to $2.50 per gallon. So these 3 categories were put together. Again, Wisconsin fell into the red category. Their wine tax was 25 cents a gallon, less than $1 per gallon. The yellow category would be $1 to $1.99, and the green category would be greater than $2 per gallon. And a 10% increase in the price of wine would likely reduce wine consumption by approximately 6%. And looking at across the U.S., again, the majority of states in 2013 and in 2015 were in the red category, less than $1 per gallon. 8 were between $1 and $1.99, and only 2 were in the green category of above $2 per gallon for state wine taxes. So we have a long way to go on those being in the best category that they could be, as far as the evidence shows. Moving on to the second type of policy in the PSRs for alcohol is commercial host liability, also known as dram shop liability. And the data for this comes from 2 different sources. First of all, the annual report to Congress on underage drinking, and secondly, from a legal analysis published by the Alcohol Policy Consultation for Intoxicated Adults, and from Change Lab Solutions, the status of dram shop liability as of November 2015. So dram shop liability, or commercial host liability, holds the owner or server at a bar, restaurant, or other location where a person, either adult or underage, has consumed his or her last alcoholic beverage and then gets into some kind of difficulty responsible for the harms subsequently inflicted by the patron on other people. The liability in the state can be established by case law or by statute. And states are rated on whether they have commercial host liability, and if they do, whether there are major limitations to the liability. So the major limitations include, first of all, coverage either for underage persons or for intoxicated persons, but not for both. So that's one limitation. The second limitation is that there's increased evidence required before finding liability, like, for instance, having a greater burden of proof, for instance. The third limitation is limits or caps on the damage awards that can be found. And finally, the major limitation would be restrictions on who can be sued, whether it's the server or whether it's the business itself. So those are the 4 limitations that the states are based on. So the way this worked out then was that if there were no commercial host liability at all, the states would be rated red. If they had some commercial host liability with major limitations, they were rated yellow. And if they had commercial host liability with no major limitations, they were rated green. So you can see our Wisconsin example has commercial host liability with major limitations, which would categorize it in the yellow category. Across the United States, again, the majority of states are in the yellow category, so they do have commercial host liability, but some with major limitations. Only 20 in 2015 and 2013 had commercial host liability with no major limitations, and 6 of the states had no commercial host liability whatsoever. Finally, the third policy that I want to talk a little bit about is managing and regulating alcohol outlet density. And again, as I said, this is provided in the 2013 PSR data. It's difficult to monitor these at a state level because these are mostly managed, or they're managed in the best case scenarios at the local level. So these are not included in the 2015, but you can find information about them in the 2013 data. So alcohol outlet density really talks about the number and concentration of alcohol retailers in an area. So those could be stores, bars, or restaurants. And greater density of alcohol establishments is associated with excessive alcohol use and related harms, including injuries and violence. So the way that this looked in terms of the 3 categories was that red states were states that had exclusive state alcohol retail licensing, and there were 8 states as of 2012, January 2012. The yellow category was for states that had exclusive state alcohol retail licensing, but had some local zoning authority or other kinds of mixed policies. And there were 24 of those states in January 2012. Finally, in the green category, there were 18 states that had exclusive local or joint state and local alcohol retail licensing. Thank you, Dave.
And so thank you, Sharon. What Sharon has done is taken the 3 policy-based strategies and provided a very clear definition of what they are, what data are provided, and what the state status is. And so that's what the PSRs do. They take fairly complex problems, excessive alcohol use, and some very clear but somewhat complex strategies and try to make them simplified so that people can have the information and have discussions about how at the state and at community levels we can address the excessive alcohol use, potentially with these strategies. And so what the Center for Disease Control has done, they've provided, and if you go out to the website at www.cdc.gov/PSR, you'll see that there are 3 types of information provided. The first type is the state summary report. So you can download the state summary report on alcohol-related harms, but also any of the other 9 other health-related topics. And so here's where you get your state-level data, the ratings on each of the proposed strategy solutions, and you get that all in one report. So that's wonderful, and it's a wealth of information. You can also download a fact sheet. This talks about how the prevention status report is organized, where the data comes from, describes the policy ratings that Sharon just described for us, and they talk about how to get started using the information. And then finally, there's a quick start guide, which is it's a wonderful tool. It's more of a worksheet that allows you to start analyzing the information provided for your state and lets you to start thinking about how you can start using that information to have discussions, again, at the state level and at the community level. It provides information, suggestions on how to use the prevention status report, provides a worksheet to review the policy status of your state and identify areas where your state's doing well, potential areas for improvement, and then start to identify what are the reasons why our state has that particular status. And that allows you to, again, start to organize the information so you can have conversations with potential stakeholders. And so it provides a framework for you to have a discussion at both the state and the community levels. And so what's really exciting and where CADCA and ChangeLab Solution comes in is the Center for Disease Control realized they have a wealth of information in these prevention status reports, and they wanted to take even further steps to communicate and disseminate these reports to communities and states. And so the Center for Disease Control contracted with ChangeLabs, and ChangeLabs has developed some PSR-related material that is still in the final stages of development. I've told you about our project with them. Our project was to provide feedback on them so at the resolution of this project, these will be available to all of us for use. I'm very excited about that. And this material that ChangeLab is providing, the first is an infographic, which is a one-page summary, a very clear descriptive summary of what is the problem and what are potential policy-based solutions. The second is a PSR user guide, or really it's a series of frequently asked questions that provides the information that Sharon provided to us. But it provides it in very detailed form. It provides information about where the data comes from, what the evidence are, how the evidence-based strategies work, and also how to have conversations or how you might engage people in talking about these particular issues. And then finally, there's the resource links, which provides actual website list links to resource on both the problem and the potential solutions, those evidence-based solutions. So you too can become an expert on these, and it really equips us with all the information that state and local policymakers, state and local prevention providers need to have a good conversation around alcohol-related harms. And so just to let you know, if you do want to get more information about ChangeLabs, that information at www.changelabs.org. the prevention status reports. And the prevention status reports are based on information. If you haven't seen the community guides provided by the Center for Disease Control, they provide a wealth of information about a variety of health-related topics. There is a guide on alcohol. So these are 3 wonderful resources for you. And if you want to find out even more information and you can't seem to type in the code, you just do a Google search on CDC PSR. It'll take you directly to the information. And so as I mentioned, Change Lab was contracted by the Center for Disease Control to put out the supplemental materials. And then Change Lab, I can tell you in their wisdom, decided that we really want to make sure that these are useful to states and communities. So they went to CADCA, an organization that obviously has a lot of experience working with states and communities in the prevention-related field, specifically in relation to alcohol and alcohol-related harms. And so we developed a project, and you'll see for several months, where we had 2 main goals to the project, and this is where our expert panel came in. The first goal was to provide feedback on the materials being developed by Change Lab. So we have met through several occasions, both face-to-face, many webinars with our expert panel where they provided feedback on each of the webinars, on each of the materials, the infographics, the user's guide, and the reference sheets for each of the 3 strategies. So they were busy providing feedback to us, and we've included that in our dissemination report. The second is to provide technical assistance and idea on how we can communicate this information. And so this webinar is one element of that, and that's why your feedback is so important at the end of the webinar, to share with us how the information was useful to you and then provide us with any questions you have. So you can see on this next slide, we're at the end of the project. We're just providing this last webinar, the second of 2 webinars, and so we'll be able to, based on your feedback from the first webinar, complete our dissemination report, which includes recommendations to Change Labs on, again, how the format of the documents themselves, but also recommendations on how best to disseminate the information. And so part of our analysis and an understanding of what we were doing as we went through the project, we recognized that the Center for Disease Control and Change Lab Solutions really is looking to CADCA, part of this project, to make recommendations on how to disseminate the information to 2 particular target audiences. The first are state-level stakeholders. These are people that work in the governor's office, departments within the state, nonprofits working at the state level, state legislators, with the key information about the alcohol-related harms problem and potential solutions. So we're talking about sharing information here to state-level stakeholders and also to stakeholders at the community level. So it could be at cities, within counties, within parishes, so who are decision makers within the local communities. And so we're providing information there. And so CADCA provides the information both directly, or can provide the information both directly to the stakeholders, but also a key mechanism, and one of the strengths of CADCA as an organization is our relationship with the many coalitions, over 5,000 coalitions across the country who are working in the states and communities. So the second way we're looking at this is what information could CADCA provide to coalitions who then themselves would provide this useful information about the prevention status reports to the state and community level stakeholders. So this is the context, if you will, on what the expert panel provided recommendations to us. And so just as a summary of these recommendations that were provided, is just the general recommendations is from the expert panel is that the CDC, the Center for Disease Control and Prevention, is seen as a credible source of information. And so in our communications to stakeholders, it's important to let people know that we're not making this information up, that it's based on science, it's based on fact, and we can rely on the Center for Disease Control as the source of this information. So that's a key part of any communication. Also, where it's appropriate, and this is where the local coalitions come in, is when we provide data, it's important to provide the local data. So the prevention status reports do provide the state-level data. When we start talking about local communities, it's up to local community prevention providers and coalitions to really add that local data. and what's helpful in the information that the expert panel identified, can we identify some of those data that might be available to the local prevention providers so they can add the local data to their sharing and information. The other key element of any sort of dissemination of information is that it occurs through relationships and people talking with one another. So it's enough to provide information, but these tools need to be in a way that they can be understood by both the giver of the information and the receiver of the information. So if we're going to be talking to stakeholders, that's going to be one-on-one or small group sharing situations where this information can be provided. So we needed to keep that in mind as we were thinking about developing and promoting the materials. So these are some general comments. When we look at the recommendations from the state level, we can see it's that at the state level and at the community level, these decision makers, stakeholders, are busy people, so they don't have a lot of time to read large information, and often the best way to reach these decision makers is through their support staff or through gatekeepers, if you will. This could be a chief of staff, a committee staff members, administrative aides. But so we need to get the information to these gatekeepers who then can share the information with the stakeholders, with the decision makers. And so the information must be provided in a way that is clear and concise. People don't have time to read. The gatekeepers may read longer documents, but in their sharing, they need short, concise, one-pagers, if you will, to be able to share this information with the decision makers. Also, they've seen that in certain situations where an agency may want to send out the information to a broader group of people, that needs to be electronically communicated so they can disseminate the information to a broad set of target audiences. They also see that CADCA is a credible source for providing information to coalitions, and we'll talk a little bit more about how CADCA does disseminate information. And also, we need to provide a variety of information that is flexible, because not one size fits all for providing information to people. And so when we make recommendations, see the recommendations at the community level, we see similar recommendations to disseminate this information, that it must include local data. So again, the role of coalitions is to provide that local flavor to the situation, that what is the problem with effects of alcohol use, and what is the status of these evidence-based, policy-based strategies in our local communities. Coalitions play a key role. The expert panel identified many tools that could support coalitions in doing this, dissemination at the local level. And just as at the state level, CADCA is a useful, credible organization for sharing information. And again, we need to be flexible in what information we provide that is provided, because, again, not one size fits all for sharing information. So as I mentioned, the expert panel did recognize the value and the need for the variety of ways that CADCA can disseminate information. In getting the information about the PSRs and about the supplemental information being developed by Change Labs, CADCA can use, as you can see here, a variety of web-based, mostly web-based, but some print-based ways of sharing the information. So we really appreciate all the expert panel's feedback to us in, again, both the format and content of the information, and also the best ways to disseminate the information as well. And so, as we mentioned, when you do receive the follow-up survey from this, we appreciate your comment about this information. We provided this information here for you, and that's a short, less than an hour. And so you get a sense for what the level of information is, how complex it is, and a little bit more about the details of the information. So we encourage you to go look at the PSRs that are available on the CDC web pages, and then provide information, some feedback to us about what you've heard here today. And so that's what the survey that will be provided to you at the end of this webinar. And finally, we do want to recognize the members of the expert panel who I see some of you have joined us on the call. So we thank you for your commitment to this process. And as you can see, we had representatives on the left-hand side here from coalitions from throughout the country, a range of urban and rural and suburban coalitions that were providing their information, their view on the best way to disseminate the information. And then you can see we had representatives that the state National Prevention Network representatives from a variety of states sharing their wisdom with us as well. So we thank the expert panel members